Yes, good afternoon. And we're after the weekend and with some numbers and data to report today. On that, we're seeing some continuing good directions in the overall data that's being brought forward with our numbers. But again, we want to look at the trends. While there's up and down days and that, it's more the overall direction and how it's going in there, because a lot of those dips and things respond to a number of different system issues that have to be addressed and flows of information and materials. So we're going to talk about that and to make sure that we're continuing on our trend direction as we want to look at our public health measures and when we can give advice to the minister and to the cabinet and premier when we can go to the next phase on that. And so everybody is eager to see how collectively as Ontarians we are doing in that regard as we progress through the process of the community cases as well as with the outbreak in the long-term care facilities that we're dealing with in the province of Ontario. So first I'm going to let Dr. Yaffe take us through the daily numbers. So over to you, Dr. Yaffe.
Thanks very much. Good afternoon. So as of 4 p.m. Yesterday, in the Integrated Public Health Information System, IFIS, we have a total of 18,310 confirmed cases of COVID-19 have been reported in Ontario. This is an increase of 387 cases from the day before, or 2.2% increase. 57.5% of the cases are in women, 44% are people 60 years of age and over, and just over 60% of the cases are people who reside in the Greater Toronto Area. 15.8%, or 2,892 of the cases, are in healthcare workers. This is a cumulative number, so it doesn't represent those who are currently positive. We continue to see more and more Ontarians recovering from COVID-19, with almost 70% of cases, or 12,779 cases, resolved. Currently, there are a total of 1,043 people in hospital with COVID-19, which is an increase of 59 from yesterday. Of those, 223 are in ICU. It's a slight dip in the number. And of those, 166 are on a ventilator. And tragically, we do continue to see deaths related to COVID-19. To date, 1,361 deaths have been reported, which is an increase of 61 from the previous report. With respect to long-term care homes, the Ministry of Long-Term Care is reporting a total of 175 active outbreaks in long-term care homes. A total of 1,003 deaths have been reported among residents and 3 deaths among staff. With respect to retirement homes, the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, provides data showing 66 retirement homes in outbreak and 147 deaths reported among residents. With respect to laboratory testing, a total of 352,714 tests have been completed in Ontario. In the last 24 hours, 10,654 tests have been completed, and we have just over 6,000 that are currently under investigation. And I'll turn it back to Dr. Williams.
Thank you. And so the number 387, last week at this time we were down low and then we went right back up to a high number. This is now our 4 days in a row staying down and coming down, so let's hope that that trend continues, although the flow and ebb of cases can vary depending on the IFIS reporting. In that, the data still shows that of those numbers, a bit over 50%, 53, 54% are from community cases, and the other ones are from long-term care facilities there. And the long-term care testing continues in that as we seek to get through about 160,000 tests in the next week and a half, complete that process, and it's going forward in that regard. So, but the answer there is that the positive rate is dropping down in the test, so that's good. And because there was a concern that we're going to find a lot of cases in there that was going to demonstrate really a number of problems, but we're actually finding some reassurance with a number of the test results staying at a good level there, in fact going down, but that's encouraging in that regard. So we're hoping that the data and information we're giving over will be useful to our modelers, as we hope to get some updates from them soon on how, with the updated report card, in a way, how are we doing in regards to the overall community, and then how are we doing with the long-term care, because they said, in true, there's two different curves that are being dealt with there. And meanwhile, we still have the ongoing issue of doing our testing in the staff of the child care centers, as well as dealing with outbreaks if and when they occur in congregate settings in that, as well as retirement homes, and monitoring that situation at this time. So overall, staying the course, and looking at some of the other numbers around. At the federal, provincial, territorial level, looking again at comparing our public health measures as we seek to look at how we might do that in concert, rolling back, looking at a consistent approach to the use of non-medical masks or cloth masks within our respective jurisdictions, so that we could understand how they would play a part in maintaining our public health measures if we have to have situations where, due to increased activity, people may not be able to maintain that every moment of the 6-foot distancing and may have to have some other further form of protection. And we're trying to get that data in so that what we do here in Ontario would be similar to other provinces, and that would have some consistency across the country. So we're addressing that as we do. At the same time, we're looking at different forms of electronic or apps that might help in the overall process. And again, trying to look at, can we have a consistent approach across the country, looking at different ones, because there's many different ones that have been looked at, and some our federal people are doing reviews, as we have here in the province. So we hope to have some direction and some advice on that as we go forward. So still the messaging is, if you can, stay home. The weather, I guess, is not as warm as on the weekend. I hear even some rumors of frost and maybe some snow in some areas, so that's a bit surprising in that area there. But then keep your 6-foot distancing. We have more ones that are doing some types of various businesses maintaining that distancing, as we look to see how we can do as much as we can while doing that, and still let people get outside, get their exercise they need, and still taking the proper steps of protection to ensure that we have the ongoing distancing to allow and keep these numbers coming down, as we're hoping will continue as the week goes on. So those are the comments overall, and with that, I'm going to open up for questions from the media.
Okay, we'll go to the phone lines.
Your first question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Good afternoon, Dr. Yaffe, Dr. Williams. I wanted to follow up with you about the comments that the Premier made about the regional medical officers of health across the province, and he some very harsh words for them this afternoon in terms of testing. He says that half of them aren't doing enough testing, and he wants to see that changed. Wondering, as I say, what your reaction to those comments are, and why that might be the situation, why that testing is not going on.
Now, I didn't see the actual press conference. I've heard a couple of comments, so I'm not sure I can speak to exactly what was said or what was referred to in it. In there, I think there was, if I remember, someone said it was responsive asking why the testing today was down in the mid-10,000s in that aspect. And I think that was a matter of concern, why we've been up in 17,000 and back down to 10,000. And again, we're looking at that issue when I saw it this morning, again, saying, was the problem we had last weekend, is it the same one? And last weekend, on the same Monday, when the Sunday tests come in, we had dropped down to 10,852. So we're about the same as you were last Sunday, testing volumes versus that were done on Monday and reported today. So understand that, again, the problem that we identified has still not been rectified by the laboratory network system, where there was the community labs have received many of the samples being taken by the health units, but they have stayed out in those community labs like last week because there's no system for percolating or moving those around on the weekend. And so then they come in all on Tuesday and Wednesday, and then our numbers go back up again because there's a backlog sitting out in the labs. It doesn't show on our pending. So these type of system issues need to be addressed, because in this testing, when you're doing 150,000 people, not in a system that was there before, to ensure that all team players get in, because you have a combination of public health seeking to coordinate, you've got regional OH offices, you've got paramedics helping out, you've got some hospitals helping out, you've got some other past LIN offices staff helping out. It's like all hands on deck to go out and get it. At the same time, when we started out the first time with we received a few blue recycling bags just filled with specimens with no labels on them. That can't be tolerated, because you have to have the recording, all the information. So it's only as good as the weakest link in the chain. So everybody is in this together. And so looking at how we make sure each health unit steps up to the task in the coordination. I've had trouble the weekend with some had been ready to go, but the swabs did not arrive to do it. There's some got new swabs they hadn't seen before, and there seems to be some shortages in areas, and we're still trying to address that. So there's supplies, there's coordination, there's data entry, there's procurement of the samples being sent in, and the testing that. So it's a system-wide approach, and I think that, and I agree on the aspect there. If there are aspects that are not up to speed, we want to go after all those ones there and saying, how do we fix those issues? We don't need excuses in that mind. We need solutions, and we continue to drive and work at that to make sure we get all this done in by the end of next week. And we're fairly on track with that, but we want to get that in and have the data accurately recorded and accurately analyzed, because if it's not done correctly, then it becomes less than quality information. So there's many aspects in there, and so we're addressing all those as we have to in a system-wide approach with the many partners that are trying and endeavor to do this and want to do it correctly, do it effectively and efficiently, and on time. So we're working on all those fronts.
Follow up?
Dr. Williams, I wanted to follow up with you on another issue entirely. It's about the resumption of the NHL season. Premier Ford acknowledged that there's been some very preliminary discussion with Maple Leaf Sports Entertainment about, I guess, the possibility of Toronto participating in that in some way. There's been discussions of having hub cities where the game is played. Dr. Bonnie Henry in British Columbia said that they have had discussions about how that could happen with the World Health Organization out in Vancouver. How would you like to see that take place, if it were to take place safely in Toronto? What measures could be used or employed to keep players safe?
Right, and it's a good question. We can't guarantee a Stanley Cup. That's one of the challenges in there. I think it asks the organization, say, how would you, one, first protect your players and your coaching staff, et cetera? And I think they have to address that. The more challenging one for us would be, how does one have, instead of an empty arena, how does one have people attend that in a way to maintain certain distancing? That's why we're looking at as much as we can with the facial covering. Although it's a little hard to have facial covering and have your popcorn and whatever. So to do that. So these things you have to look at, those pragmatics that you'd have to work with the organizers because of all the economic aspects and how they would want to carry it out with enhanced television, and people could virtually, of course, as they always have, attend the game. And so I have not been approached in that, because we have two teams here in Ontario in that, and how they would want to work with the local public health. And an idea, because when you're getting these large crowds, we'd be at basketball or hockey, and then later football and soccer and other ones. Is there ways you can do it in a way, in the new norm, in a safe way? And we're looking for ideas and suggestions, not just from our teams, but if there's others in other parts of the U.S. and Canada that have suggestions and ideas that would meet these two things, that would be a good discussion to have. But I have not been part of that yet, but I'm sure they're going to have some suggestions and ideas to come forward. And I'm sure their fans would like some ideas and suggestions to come forward, even if it couldn't guarantee a Stanley Cup. But anyways, we'll have to see what they have in mind. So we're open to hear some suggestions and ideas, but it's still early days yet. But we'll wait to hear from them, and not only from Toronto, but from, I guess, in Ontario, Ottawa as well.
Next question.
Your next question comes from Travis Darraj with Global News. Please go ahead.
Hi there, doctors. I just want to follow up on Sean's initial question. Doctor, you said that we don't need excuses right now. We need solutions, but you preceded that with a long list of excuses. And I think the folks in Ontario right now are wondering, why are we still struggling with testing months after this outbreak began?
Right. So that wasn't a long list of excuses. That was a list of the various components that play a part in this. And each part is critical when you're undertaking to do a massive survey in a very short period of time, and to do it so you don't lose samples, lose records, and miscue on that. Because when you do all those tests, those individuals need to know what the results are, positive, negative, and so do the residents and their organization, the staff, I should say, and their organizations. So I wasn't giving a list of excuses. I was saying a list of the various components that each one is its only good as the weakest link in the chain. That means we don't just say one and that's the blame on the whole thing there. We look at a number of different ones and saying, what is the system issues that we have to fix? And we go at it and we have to go back at it again, and we're going to continue to try and work on that, not looking for excuses, looking for solutions, and do it expeditiously and get on with the task. As far as the ones with the long-term care in this issue here, our main concern was that how do we assess each of these homes to make sure, one, are things in place to prevent very unfortunate large outbreaks where there is a compromise of the staffing, the services to these residents, and increased mortality in that basis there, as well as infections entering into the home. And therefore, we have moved quickly to look at the components I said before. The testing is only one thing you do. The important ones you have to do is the infection prevention control practices to make sure there is the personal protective equipment if in the event of an outbreak they need it or before that, as well as then the staffing situation. Is it adequate to carry it out if in case you do get a case or outbreak where some of your staff, a good third or half, may be compromised in isolation, and then you're leaving the staff, the remaining few, with too little resources to deal with the residents and leaving them uncared for. We brought in the armed forces. The IMS team is bringing in hospital services to assist. So they're doing that in that case there. So they are responding to the issue. The testing is just one component of the survey in that regard as we move the reds to yellows and yellows to green.
If I could just add to that, just focusing on the lab testing, it's not just reflecting the work in long-term care. It's reflecting all the tests that are happening across the province. And the majority of tests depend on people showing up at assessment centers or going to the hospital if appropriate to get tests. Public health is responsible for coordinating testing only in the long-term care homes at this point, and child care. So, and I am confident those numbers will be going up very quickly. So I think, you have to look at the whole picture.
Follow up?
To both doctors, just a brief, concise answer would be appreciated. Do you agree with the Premier's assessment that some regional medical officers of health are not holding up on their end of the bargain? They're not being responsible when it comes to these testing numbers. He says that he's disappointed. He's not going to name names, but, quote, start picking up your socks, he says to them. Do you agree with that assessment or not, just very briefly?
We're looking at the data and from the different ones. And yes, we have been contacting different health units, and we're asking, why are you not? Why is this happening? Is there reasons? Why can't you pull up the socks, if you may, and do it? So one is to assess to see what is the issue. Is there a supply issue? Is there a HR issue, a staffing issue? Or is it a matter of a data flow? As we found, some have done them all, and there was an assumption the data was being automatically offloaded up, and the system didn't do it. So therefore, there's many things in there that they may have been seen as being less than rising to the occasion when there is a system issue that needs to be looked at and rectified. But if they're not pulling up their socks in that sense, we will talk to them and ask them to do just that. And so we're looking at each one independently on what their long-term care homes are, and to make sure that if they're not going full force, they will be, but we're going to help them do whatever they need to do it well and get on with the job.
Next question.
Your next question comes from Tracy Tong with CTV News. Please go ahead.
Hi there. This question is for Dr. Williams. Given that the directive has been for the public to really not go test unless they are part of this priority population, how accurate of a picture do you think that we are actually getting when it comes to COVID cases in the public? And when could we see this being expanded?
So I'll comment first. As I said before, that priority testing is a list of the ones that are going to be priority-wise run through the laboratory to get the results back as soon as possible. It's not a priority list as far as who is eligible or not eligible to get a test. And as I said before, and as Dr. Yaffe just alluded to, in our over 110 assessment centers, we have made it clear to the public that if you have any symptoms compatible with COVID-19, remember we started with severe or major way back, we expanded that to other symptoms, and we've expanded even further with some of the new ones that have been added in there. So the fact that even with mild symptoms, you can go and get tested. I am aware that at some of the assessment centers, there are various physician leads who have made, because it's a guidance document out, they may choose to prioritize some of those ones coming into the testing center. We have asked that they would not, because we want to do more wider testing. And as Dr. Yaffe said, a lot of the testing that comes in every day is from those assessment centers, sometimes over 4,000 to 5,000 specimens at least from that. So, no, we have not restricted it to the priority list of testing only. We have made it as wide as we can that people can go. And again, we're asking our assessment centers to be fairly flexible on that and to undertake that. But some were aware that they thought there's a shortage of capacity in the labs. That might have been their local lab, whereas we're part of a network, so they can move those around. So that communication out to those assessment centers that they had some limitations is seeking to be rectified, and they can now do as much testing as they feel they need to do and that we would like them to do in that regard.
Follow up with the Premier's comments this morning, saying that they want to look at, and the province wants to look at, the Alberta model. In your position as Chief Medical Officer, do you think that having one Chief Medical Officer of Health is better than having 34, as the Premier stated? How would that change things, and would it be a better way?
Well, I wasn't there when the comment and how it was placed and what does the Alberta model mean in that perspective. As you know, we have been in the process of looking at our public health system in Ontario, and we have a dynamic situation here with municipally run local public health units that report to local boards of health. And unlike in some of the other provinces, the local MOHs do not directly report to the Chief Medical Officer of Health in that sense there. So it is a different structure, and why it has its complexities and issues in there. So we're continuing to review and look at the matter and what model works best. Each one has strengths and weaknesses, and we will continue to, once this is over, complete the consultation process. As you remember, there was Mr. Jim Pine, who is the assessor, and who will be giving advice and direction to the Minister of Health. But that process has been delayed because of the COVID-19 situation, and so that's yet not completed.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Dr. Williams. Hi, Dr. Yaffe. Just following up on your answer to one of Travis's questions, Dr. Williams. When Premier Ford was speaking today, he had identified in his mind these 17 medical health officers that he was speaking about. He said he wouldn't identify them to us. And you said that you have been in conversation with these health officers. And I just wondered, how long into this pandemic, how long have they been struggling to get the testing done?
So to be clear, I 17, so that's news because I hadn't seen the media event, and I don't know what list that was from. So when I said if they asked had I been speaking to any ones that were having difficulties, the ones that I've identified or in different ones that either Dr. Yaffe or our team have spoken to. So we're dealing with those on a one-off basis. I don't know what's on those 17 list. I may have a different list and different aspects there and different data sources to deal with that. All along, the testing in that, as we carried out the initial part, We have been doing it through all the outbreaks and managing those, keeping those under control. As you know, we did well with case contact management through all parts of February and into early March with the influx from China as well as Europe and Italy and Iran. And the health units had done the work to keep that under case containment and control, so we didn't have massive numbers in those months there. So up until that time, we kept on top of it on that one there. This aspect of going out doing a system-wide survey in the long-term care homes, not related to outbreak per se, is not a normal task of public health, but public health wanting in participating in the process to help coordinate that because we have more in the local area, and having had a long-term history of relationships with long-term care homes, was willing to step up and do that task, as well as to give an opportunity to continue to improve on the infection prevention control practices and knowledge base to make sure that the homes that had not had outbreaks would continue to not have outbreaks and to move them from the red to the green, etc. So that task of doing a system-wide survey is a new one. No other province has done that, but it's one that's a large one, nearly 700 homes throughout the province with nearly 87,000 residents and close to nearly the same number, if not more, staff in various locations. So it's not a small task. It's one we have to step up to. We're asked to do, and we need to complete that survey as soon as we can. At the same time, deal with outbreaks, if there are some in the homes, that the medical officer of health and the team will have to deal with in managing those outbreaks in concert with the IMS team now, under Dr. Kevin Smith in that regard. And there's still the other outbreaks that are going on in the other settings, as well as case contact management that has to be ramped up. And there's other outbreaks, foodborne and water issues and things happening in spring, including issues with flooding and that kind of stuff. So the other business of public health is not on a halt, because other disease issues and processes will not delay because of COVID-19. So in a sense, I think they're doing a number of things as much as they can at this basis here, but we just need to get the job done.
Follow-up?
And in terms of COVID-19 testing, in the surveys that you're doing and the conversations that you're having with the 34 of the province's regional medical officers of health, have any of them expressed in the past week that testing supplies are an issue, that there is a shortage?
Yes, they have. And some have been waiting and were ready to go on the weekend, and they were not given the supplies to give to the home to get the place going, because you have to get all the lab specimens labeled first before you do it and tabulate, because not every staff member will be at that home that weekend. And so you have to look how you're going to capture some more of those on that basis. So a number of them have said, we were ready to go. We didn't get either the adequate supply or the correct swabs out to our area, and we weren't sure about how this was going to be undertaken, because if you're going to do a survey, you should do it in a quality way. So there were supply issues noted.
Okay, we're going to move to our last caller.
Final question comes from Phil Perkins with CHCH News. Please go ahead.
Hey there, doctors. The Ontario Fire Marshal put out a warning today after hearing stories, nothing official, that some people may be microwaving their PPEs, their personal protective equipment, particularly their masks, in a way to disinfect it. They're saying that's, of course, a fire hazard. So for those who do have reusable masks to wear out in public or going grocery shopping, what's the best way to clean these, to disinfect these masks?
So maybe I'll take that one.
Go ahead.
If we're talking cloth masks, every time after you use it, you should wash it, launder it in hot water, regular laundry. Definitely don't put it in the microwave. That's a fire hazard.
Follow-up?
And no, we'll end it on that. That's good. Thanks.